o'clock. I'm coming in. As I walk into the room, I'm going to be washing my hands for 20 seconds starting now. Okay. Hello, my name is Radley and I'm going to be your nurse today. So what I'm going to be doing today is I'm going to be doing some tracheostomy care. But before we get started, I would like to establish a means of communication. Thumbs up, yes. Thumbs down, no. And if you are in any pain, raise your hands up, okay? Okay, so I'm gonna just verify your name and date of birth first. Is your name Daniel Jones and is your birthday 12/12/2000? Yeah? Okay. And is it okay if I call you Mr. Jones? Okay. Do you have any allergies? No. Any sensitivities? No. Okay. And have you done this procedure before? Yes. Do you have any concerns or questions before we get started? No. Okay, so I'm just going to take a look at your vitals. I do see that they're all stable. And also, are you in any pain right now? No? Okay. Your respiration rate is also good as well as at 18. However, your O2 saturation is 92%, which is a little low. Okay. So I'm going to take a look at your chest. It looks like there is no evidence of increased work of breathing, which is good. Okay, Mr. Jones, I'm going to be taking a listen to your lungs now. Okay. 20 seconds. Okay. Take a deep breath. Another deep breath. Deep breath. Deep breath. Deep breath. All right, one more. Okay. Looks like you have some secretions in your lungs, okay, Mr. Jones? So we're gonna have to do some suctioning today, okay? 20 seconds. Okay. All right, I'm just gonna let that dry for 2 minutes, 20 seconds. In the meantime, I'm just gonna be looking at my emergency supplies. I do see that I have an ambu bag connected to 100% oxygen. I also see that I have a suction catheter that's connected to the suction canister. And then I also see that I have 2 trach tubes, one being of current size, size 6, and one being a smaller size, size 4. And then lastly, I do see that I have an inner cannula, so it looks like I have all my emergency supplies at the bedside. Okay, so I'm going to close the drapes and the door for patient privacy. And I'm going to raise my patient's bed to high Fowler's. Alright, Mr. Jones, I'm going to be raising up your bed now. Okay. Alright, my table is now dry for 2 minutes, so you can wash your hands for 20 seconds. Put some clean gloves on. Okay, so I got my gloves, hand sanitizer, got my trick tray, normal saline solution on my inner cannula, got my trach stabilizers, and I got my suction catheter. Okay, so I'm just gonna open up my trick tray. I got my sterile gloves that I don't need, throw it away. I'm going to make sure I touch only the 1-inch border of my sterile drape. Okay. And then, okay. I'm just going to be, okay, putting that over. Okay. And then I'm going to drop my inner cannula. Okay, dump that, and then I'm going to set up my saline container. Okay. And then I'm going to pour some normal saline. Make sure it's filled halfway. Pouring some normal saline onto my trach tray. Okay. And then I'm going to replace the old suction catheter. Twist this off. Dump that in the garbage. And I'm going to grab the new suction catheter. Dump that in the garbage. And then twist that back. Okay. So now I'm going to adjust the suction catheter to 120 millimeters of mercury. And then I'm also going to be testing my ambu bag. Okay, my ambu bag does work, so I can hyperoxygenate the patient. All right, Mr. Jones, I'm going to be hyperoxygenating you now, okay? So, because your O2 sat is low, before we start the suction. Okay? So 3 breaths, okay? Ready? 1, 2, 3, 4, 5, 6, 2, 1, 2, 3, 4, 5, 6, 3. Okay. So it looks like your O2 set is now at 98%. So now we can proceed with suction. Okay. So now I'm just going to be testing my suction catheter. Exposing around 3 inches. Okay, it works. All right, Mr. Jones, I am going to be suctioning you now, okay? So I'm going to expose around 3 inches, okay? Just going to put this into... Okay, Mr. Jones, ready? Start. 1, 2, 3. Cough, cough. Okay, suctioning is good. So now I'm going to be putting back my oxygen device. Okay, just gonna put this back in the head of the bed. All right, Mr. Jones, how is everything? Was everything okay? Are you breathing a little better? Good. I do see that there's no evidence of increased work of breathing, so that's good. And Mr. Jones, do you feel like you need more suction? No? If you do, I would have to wait 30 seconds before I can start with the next suction. And I also see that your O2 sat remained at 98%, so currently I do not need to do any hyperoxygenation. Okay? Okay, so now we will change our gloves. 20 seconds. Glove change. Mr. Jones, I'm going to be changing your inner cannula now, okay? Alright, so I'm going to take that out with my non-dominant hand, 2 color. And then I'm going to be taking out the inner cannula with my dominant hand. Dump that in the garbage. And then I'm going to grab the new inner cannula. Make sure I don't touch the wings. Okay. So I hear click, click. Okay. And then after that, I'm going to be taking out the dressing. Dump that in the garbage. And then I'll do my site assessment here. I do see that there's no redness, no signs of infection, no swelling, and no evidence of skin breakdown. I also see that the device is intact and that there's no cracks. So everything looks good on my site assessment, okay? So I'm just gonna put this back, push the collar back. Okay, all right, I'm gonna do another glove change again, and then I'm gonna assess the chest. So far I do not see any evidence of increased work of breathing, so the patient looks good. So wash my hands for 20 seconds, do a glove change. Okay, All right, Mr. Jones, I'm going to be cleaning your site now, okay? And putting in a new dressing. Okay, so I'm just going to take that out. Okay, and then now I'm going to be dipping gauze here. All right, I'm going to clean the bottom part, okay? Dump that, dip that, another one. Dump that, and dip that here. And let's say, dump that in the trash. And I'm gonna clean under here. Dump that, and then one more. Saline. Cleaner on the faceplate. Okay. Dump that in the garbage. And now I'm going to do some pet drying. Okay, and then dump that in the trash. And then now I'm going to be putting the split gauze, or the new dressing. Okay, everything looks good, so now I'm going to put back the auction color. Alright, Mr. Jones, how was the overall procedure? Was it good? Did you feel any pain or discomfort? No? Okay, good. So now I'm going to be leaving for a little bit. I'm going to be changing your trach stabilizers, so I will be getting another nurse to help me do that. So I'll be back in a few moments, okay? Alright, so I'm going to wash my hands. 20 seconds. Throw away the things I do not need anymore. And throw in the garbage. And then, Mr. Jones, if you do need anything, here's your call light. Don't hesitate to press it, okay? Okay. In this part of the video, I'm going to be changing the trach stabilizers by myself. However, for the purposes of this video, I will be pretending to have a second nurse with me because I know that in reality I would have to have a second nurse. Alright, okay, Mr. Jones, I got wash my hands for 20 seconds. My second nurse with me, so now I'm going to be changing your trach stabilizers, okay? Alright. I'm going to take off your oxygen device first, okay? Grab my trach stabilizers. And the trash. Okay. Alright, so let's begin now. Have my second nurse stabilize that for me. Okay. And then I'm going to do my skin assessment. I do see that there's no signs of infection, no redness, no swelling, no evidence of skin breakdown, so that's good. Okay. Alright, so I'm going to push this to the other side. Alright, Mr. Jones, my nurse and I are going to lift you up, okay? We're going to check your neck. So I do see that there's no evidence of skin breakdown, no signs of infection, no redness, no swelling. So everything looks good on the neck. Okay. And then the second nurse is going to take that out. Hold down the faceplate. Okay. Throw that in the trash. Okay, and then my second nurse does see that there's no signs of infection, no redness, no swelling, and then no evidence of skin breakdown. So it's good on that side. So everything looks good now, so I'm gonna check the stabilizers. Okay, looks like I can fit 2 fingers, so it's secure. Just gonna put this back. Okay, how's everything, Mr. Jones? Everything good? Good, no pain or discomfort, good. You're breathing a little easier? Good. Okay, so I'm just gonna check your vital signs now. Vital signs are stable, respiration rate at 16. O2 sat is at 99%, which is good. And then I see that there's no evidence of increased work of breathing, so it's good there. So I'm just gonna dump this. And then I'm also gonna actually clean your suction catheter as well. And of course some normal saline halfway. And I'm gonna clean your suction catheter that I used earlier. Okay, it's now clean. You can put that back at the head of the bed. Throw these away. And then I'm gonna wash my hands for 20 seconds. I'm just gonna take a listen to your lung sounds, okay? Breathe in, breathe in, breathe in, breathe in, breathe in, breathe in. Okay, everything sounds good. Okay. Now before I go, Mr. Jones, do you have any questions for me, concerns? No? Okay, good. So here's a call light. Just let me know if you need anything, okay? Don't hesitate to press it. Okay. So I'm gonna leave the room, 20 seconds. As I leave the room, I'm going to document the date and time, the patient's tolerance. I'm also going to be documenting the respiratory assessment, the vitals, O2 sat, the site assessment, and I'm going to document that the patient had clear, thick sputum, and it was around 40 milliliters.